Hi and welcome to my podcast, the Fertility, Motherhood and Wellness Show, True Stories with Dr. Rajeev. Through this podcast, I will be dealing with issues related to fertility, safe motherhood practices, as well as women's health. There is a very popular song from one of the yesteryear's Bollywood movies, which goes as मेरी जिंदगी ने मुझ पे एहसान क्या किया है, जीने दे न मरने दे, मुझे ऐसा गम दिया है. Meaning, what is this favor that life has done to me? It has given me this grief, which neither lets me live nor lets me die. While this song of course portrays the pains of a jilted lover and concerns the matters of the heart, it could as well hold true for endometriosis. Those who suffer from this will agree that the disease won't kill you, yet won't let you live in peace either. A discussion thus on such an important topic can't be short and can't be a monologue, and that's why Dr. Apoorva Pallam, Reddy and I are here for a 3-part series on endometriosis. Dr. Apoorva Pallam Reddy is a gynecologist, IVF specialist, laparoscopic surgeon and aesthetic gynecologist from Bangalore. At a very young age, she has achieved the knowledge and expertise that's absolutely enviable. We work together on many projects, including hosting a series called What Women Want on Instagram, as well as an academy for training young gynecologists in infertility called the International Fertility Academy. Thank you, Apoorva, for agreeing to do this together.
Thank you so much for having me, Rajeev. I think this definitely was a very needed initiative. And I must tell you guys, the amount of research and work that Dr. Rajeev has put in accumulating information for you regarding endometriosis is tremendous. So I'm really looking forward to being a part of this series and sharing not only our experiences we've had with dealing patients of endometriosis, but also giving you the right information. So thank you, Dr. Rajeev, for having me.
Thank you, Apoorva. That's a very valid point for giving the right information, because there's so much of information available on the internet, most of which is not correct. So let's kickstart the discussion. How would you describe what is endometriosis to your patient?
Now, endometriosis is a condition where the lining of the womb or the uterus is actually found outside of it. And this can be either inside the pelvis or what would be colloquially known as the lower abdomen. Though it has been seen in other rare parts, like sometimes even in the heart, lungs, eyes, and even a cesarean section scars. So what normally happens to this lining of the womb, say in a normal course of a cycle?
So this lining starts to form and grows thicker after the menstrual period ends. This process continues for about 25 to 28 days, and then if the woman has not gotten pregnant in that cycle, then the lining breaks down and is shed along with the blood through the vagina. This is what we call periods or menstrual bleeding. Before we move forward, I think our listeners need to know a little about why does this endometriosis happen, because I think I keep getting this question, and I'm sure you do the same, as to why does this happen? Did I inherit from my parents, and did I do something wrong in my life, and so on and so forth. So you want to shed some light on that?
To be very honest, we don't have an exact answer for this, and we don't know why it happens. But yes, there are many hypotheses which state could be the probable reasons for endometriosis. Some say that the lining actually travels through the fallopian tube and falls into the tummy, which is what we call as the retrograde flow. And some says it travels through the blood vessels, while some are of the opinion that the cells located outside of the uterus actually change into metamorphosis into uterine lining cells. Now, endometriosis sometimes does run in the families, and it is more common among first degree relatives. Like for example, if your sister or your mom or her aunt actually have endometriosis, then there is a very high possibility that even you might have some degree of endometriosis. and it is more likely to occur in women with certain specific characteristics, like if you've had your first baby after the age of 30, or if you've never had a baby, started menstruating very early than what normal women do, have very short menstrual cycles. That is, if you keep having your menstrual bleeding for less than 27 duration, or if you have very heavy flow. Now, if you notice the pattern, all these risk factors, or so we say, are something which are related to women experiencing either prolonged or heavier menstrual flow, which again reflect back to the same hypothesis of having a retrograde flow of the menstrual blood into the cavity. Along with that, sometimes in case if you do have structural abnormalities of the uterus, these also put the women at a higher risk for developing endometriosis. Like for example, women with a bicornuate uterus or a unicornuate uterus with an obstructed vaginal opening, all of them have high risk of developing endometriosis. Now, there are certain situations that seem to be protective or sometimes even preventive. For example, women who have more pregnancies. As you said, the lesser amount of menstrual cycles, the lesser will be the chances of you developing endometriosis. So if you actually have many pregnancies, then it's less likely that you will develop endometriosis. If you've started your menstruation late than usual, you've breastfed for long, so you had a period of no menstruation for a longer duration, you've been on low dose oral contraceptive pills for a long time, exercising regularly, especially if they've started before the age of 15, and exercising for more than 4 hours a week, all these parameters seem to have some amount of protective or preventive effect on endometriosis. Now, I know both of us keep seeing patients with endometriosis every single day. So I would just like you to let our listeners know how common this problem is, Dr. Rajeev.
Well, how common is this problem? Quite common. Overall, endometriosis seems to occur in about 10% of women, but when we consider the subset of infertile women, it seems to be present in 25 to 50% of them. And I think that reflects in your practice and mine, and of course, fertility consultants across the country, that we see so many of them presenting when they come with infertility.
True.
Of the women who have had long-standing lower abdominal pain, endometriosis is present in 75 to 80% of them. And I remember you mentioning, Apoorva, the other day, that some of our colleagues from down south, they see so much of endometriosis, because I think in South India, I think if I'm not mistaken, in Kerala, the amount of endometriosis is huge. And, they kind of, I would probably say, out of every 4 people, 3 women would probably present with endometriosis in their practice.
Right.
So there is a geographical distribution as well to the whole thing.
Sure.
So let's discuss a bit about the symptoms of endometriosis to everyone, so that they know exactly what to look out for.
Right. So as you mentioned, Rajeev, that in certain states, especially in Kerala, it's almost like you have endometriosis until it's proven otherwise. It's that common down there. So the most common symptoms now for us, endometriosis is something that we need to look out for, because sometimes it might not always be very evident in the face. So one of the first things you need to know about the symptoms, that its severity does not correlate with the extent of the disease. So some women, even with the extensive endometriosis, have absolutely no symptoms, and others, even with very minimal or mild disease, can present with excruciating and incapacitating pain. In many women,
I'm sorry for butting you in, but I think this point is very important that the viewers or listeners understand, because both of us, I think, have a lot of difficulty explaining to people that you could be having deep-seated endometriosis, because their denial is always that I don't have a problem. I mean, you're saying that I could have deep-seated endometriosis, but I just don't have any symptoms. So how can it be so severe? Yeah. Please carry on. You're saying something.
True. True. So in many women that way, endometriosis does not cause pain until, it's been there for several years. So as fertility specialists, sometimes when women do come for us for pregnancy, suddenly, they realize that they have endometriosis, and sometimes they might not even have pain. So it becomes a little difficult for them sometimes to comprehend that. Totally agreed that the main symptom of endometriosis is pain in the lower abdomen and in the pelvic area. Now, the pain usually varies during the menstrual cycle. It worsens before, during, and after menstrual period. That's what we call it as a triple dysmenorrhea, that it's there before, during, and after your periods. And sometimes the pain may persist even after the periods are over, and this differentiates it from other common causes of pain during the period, which are actually present only during the period. Now, some women can actually experience pain even during intercourse as well. Misplaced endometrial tissue responds to the same hormones, that is the estrogen and progesterone, which are produced by ovaries, as a normal endometrial tissue that is there inside the uterus. So because of this, even this misplaced endometrial tissue actually menstruates during the menstrual cycle. So as you have menstrual blood from the uterine cavity shedding out through the vagina, here the internal misplaced endometrial tissue is actually bleeding into your abdomen, and that is the reason why you have such excruciating pain. So symptoms also vary depend on where the tissue is located. So it can, like for example, if it is there in the intestines, you can experience abdominal bloating, pain during your bowel movements, diarrhea, constipation, and sometimes even rectal bleeding. If it is there inside the bladder, you have pain during urination, urine that actually stains of blood, increased frequency of urination or urgency in urinating. And sometimes in case if it's present inside the ovary, formation of a blood-filled cyst, that is what's called as endometriotic cysts or chocolate cysts, because they actually contain chocolate-colored fluid inside. Now, apart from these common symptoms, there can be other symptoms like menorrhagia, that is heavy bleeding. If the walls of the uterus start to get affected by endometriosis, a diagnosis known as adenomyosis, women can have menstrual irregularities such as heavy menstrual bleeding, spotting before periods, or continual spotting even during the periods. These sort of features can develop, especially in case if an adenomyotic pattern also is establishing. And some other very uncommon symptoms like migraine, nausea, low backache also can be manifested in endometriosis. Now, the misplaced endometrial tissue and its bleeding may irritate its nearby tissue. Sometimes the misplaced endometrial tissue and the bleeding that's caused because of it may irritate the tissue that is nearby it, resulting in scar formations, which is called as adhesions. So these adhesions are formed between the structures in the abdomen and can interfere with the functioning of the organs. So for example, if we have adhesions that are formed between the abdominal wall or the intestines and the fallopian tubes, this can hamper fertility. And that's how endometriosis may actually interfere with the sperm and egg fertilizing and thus reducing the possibility of pregnancy. However, during pregnancy, endometriosis may become inactive or sometimes even go into remission temporarily because the hormonal production is at its least. Endometriosis tends to be inactive after menopause because the estrogen and progesterone levels are also at their lowest in this phase.
I think this is again a very important point that you've brought out, because so many a times we do IVF for someone who's wanting to conceive, has endometriosis. With IVF, they tend to get pregnant, and after 9 months they've delivered, and they probably start to think that because I had endometriosis and an IVF, there's no way I can conceive naturally. And these patients come back with natural conception so many times because of the 9 months of pregnancy, the endometriosis went into remission. So this is again something that our audiences need to know, that stoppage of periods reduces endometriosis.
Sure. Now, unfortunately, pain during periods is very common. So, Dr. Rajeev, Can you please enlighten as to how does one differentiate which one is serious and which one is not?
True. Pain is not a very uncommon symptom for women. I would safely say that more than 90% or more women would suffer from it at some point
True.
of time in their lives. When periods happen, certain chemicals called prostaglandins are released, and that is what causes the pain of periods. The pain typically starts when the period starts, and the pain is relieved within a day or two, or may require some maybe mild painkillers. However, certain symptoms may tell us that the pain is not normal and usual. Like, for example, when the pain starts even before periods, increases during periods, or even persists after the period is over. You already brought this point out a little earlier.
Right.
When the pain is so severe that normal day-to-day functioning is hampered. So I think this is again a very important point, that when your normal functioning is hampered, that pain can't be normal.
Right.
When over the years pain during periods has only increased, then again you need to understand that probably something is going wrong inside.
Right.
If during the periods passing urine or stool also causes pain. And lastly, if pain is also felt during deep penetrative intercourse.
It's going to actually sound very crazy that there are so many ways actually pain can happen. So yeah, but most adolescents, when they present with these symptoms, they're usually told that just get married and all problems will be solved. Or someone who's actually just recently got married, they kind of keep hearing that just have a baby and things will settle. And my advice to them is that if you experience any of these above symptoms, please do not ignore it and definitely see a gynecologist. As Dr. Rajeev has rightly mentioned, some amount of pain during your periods is normal, but something which is hampering, from you doing your regular day-to-day activity or work, that definitely needs the attention of an expert.
Diagnosis can sometimes be very easy and sometimes extremely tricky and based more on a doctor's gut instinct and experience. And again, Apoorva, you and I and all our fellow gynecologists face this problem day in and day out.
True.
So let's try and talk a little about how do we go about diagnosis of endometriosis.
So, more often than not, the symptom itself points towards the diagnosis of endometriosis. Now, as I've mentioned before, sometimes the endometriosis can be just inside the tummy, and sometimes it can be there inside the ovaries. So, in women who are sexually active, we doctors prefer performing a vaginal examination as it provides some really vital information which can further help us in making a diagnosis. Now, during the examination, the women will experience pain at specific points, which will clearly indicate in the direction of endometriosis. A vaginal ultrasound and an MRI can help if the following features are present, that is, characteristic looking cysts inside the ovary, as we said before, endometriotic cysts or chocolate cysts. In case if they are present, we will be able to detect them either on a transvaginal scan or an MRI. They are called chocolate cysts because they contain a chocolate colored fluid inside the cysts, which is nothing but altered blood. It's prudent to remember that even if cysts are not present, endometriosis may still be present in other forms in the deeper tissues. The tricky part is the presence of endometriotic nodules in various parts of the pelvis, which sometimes becomes very difficult for us to actually pick up on a vaginal ultrasound. Now, blood markers like CA125, when are elevated, may point towards the possibility of endometriosis being present. However, the values may be normal even if the disease is very severe. So, we wouldn't recommend getting a CA125 blood test as a measure to understand if you have endometriosis or not. When none of the tests are helping, then the diagnosis is clinched by performing a laparoscopy or putting a camera into the tummy through the belly button to see, directly visualize the endometriosis and see in case if they have external uterine lining or not.
True. Laparoscopy is really the gold standard for diagnosis, but being an invasive procedure, most women are very reluctant to get it done. And sometimes we also don't like to perform it.
Absolutely. I couldn't have agreed more. So, that is the reason why, especially when we are dealing with adolescent girls, where we really wouldn't want to go ahead and perform an invasive procedure like laparoscopy, and if all the other investigations have actually negated the presence of any severe form of endometriosis, we can directly go ahead and start treatment for them on a symptomatic basis. So this is what we call as a retrospective diagnosis. So we give them medications for about a month or two, suspecting that they have endometriosis. So in these 2 or 3 months, in case if their pain during the period significantly reduces, it speaks volumes, and we know that the patient is having pelvic endometriosis, which is not easily detected. So yes, even a retrospective diagnosis would be really helpful in a lot of adolescent girls especially.
Very important take home message here. The conventional way to treat is always to make a diagnosis first and then decide treatment. But for endometriosis, especially in unmarried women, we like to initiate treatment based on our clinical judgment, and the results itself point to the diagnosis. This is done to avoid surgery and also because the treatments instituted are quite safe and without any side effects. So because why we are bringing out this point again and again, because when these adolescent girls come, we have their very concerned mothers coming in saying that why are you instituting hormonal treatment for my daughter when you've not even made a diagnosis? So kindly make a diagnosis first. So I think this take home message is very, very important.
True. So how do we actually stage the various degrees of endometriosis per se, Dr. Rajeev?
So there are 4 stages of the disease. The staging is only valid when it is done and viewed through laparoscopy. Stage 1, of course, represents the mildest form of disease in terms of spread, and stage 4 representing the most advanced one.
More often we kind of consider, a stage 1 as a very mild form of the disease and a stage 4 as a very advanced form of the disease. But that really doesn't seem to be working in endometriosis. So one can have a very mild disease, which is very difficult to diagnose, yet she might actually have terrible pain. While on the other hand, another woman, even with a stage 4 and severe endometriosis, which is incidentally diagnosed while performing either a scan or laparoscopy, she probably would have never experienced even one single symptom.
True, very true. So no podcast on endometriosis can be complete without discussing about adenomyosis. We've mentioned this earlier in the podcast. So Apoorva, what is this adenomyosis all about?
I think we need to be more scared about adenomyosis than endometriosis, or I don't know if they're equally scary that way. So as we mentioned before, the lining of the womb, that is the endometrium, usually sheds out through the vaginal wall every single month during the menstrual cycle. Now, if this lining for some reason starts to invade into the muscle, or that is the wall of the uterus, then the resulting disease is what we call as adenomyosis. It is present in about 80% of the women with endometriosis, and women typically present with very painful and heavy periods, infertility, intermenstrual spotting or bleeding. These kind of symptoms are very, very often for women with adenomyosis. It can be conclusively diagnosed only with a biopsy, but it definitely shows certain specific characteristics, not only on a 3D ultrasound, but a transvaginal scan, and sometimes an MRI also is great at picking up this disease.
Right. So I think we've managed to cover the diagnosis on endometriosis. I know this has been very technical, this has been a lot of information, but probably I would advise the listeners to just kind of hear it more than one time to be able to absorb all the information. But I think Apoorva and I have tried that whatever information is available, whatever information is relevant, that it should be presented to you so that you don't have to go to any other site, look up any other textbook or anything on the internet for getting your most important information regarding what is endometriosis and how we diagnose it. What say, Apoorva?
Absolutely. So I think if we have to give away five take-home messages for our listeners as a quick summary, I think one, if you are experiencing severe pain during your periods, please don't be idle about it. Make sure you see a gynecologist and ensure that they are working towards looking if you have endometriosis or not. Endometriosis, like any other condition, if detected in the right time and managed properly, can be very well controlled and reduce your long-term impacts. If not, it can sometimes result in higher chances of infertility and long-term suffering with respect to period pains. And third important point, yeah, I think that's the third point, right? Yeah, third important point is it's not always necessary that we have a diagnosis of endometriosis either on an ultrasound or an MRI or even a laparoscopy before we go ahead and start treating. Retrospective diagnosis is very real and it is standardized internationally, specifically for endometriosis management. Point number 4, the pain in endometriosis has to be treated differently from the regular period pain. So taking medications appropriately in order to relieve the pain is also important, and these painkillers are not going to cause any harm, so it's very safe for you to go ahead and take it. And point number 5, this is more relevant to newly married couples or married couples that way. Deep-seated pain when you have intercourse can be a signal for endometriosis. Most women do experience some amount of discomfort at the hymenal opening, at the entry point of the vagina, but having deep-seated tummy pain when you have intercourse is not normal, and that again can signal towards a possibility of pelvic endometriosis. So keep these 5 points in mind and I think you will be well sorted.
Thank you, Apoorva, for being here and for helping me share all the knowledge. Dr. Apoorva and I will be shortly recording the part 2 and the part 3 in this series on endometriosis. This brings me to the end of yet another podcast episode. I hope you enjoyed listening to it as much as Dr. Apoorva and I enjoyed making it. And thank you for all your reviews and suggestions. You're making our work so much easier and better. If you get a chance, do look up my website www.drrajeevagarwal.co.in and the associated blog. I also have a YouTube channel in my name. Do email me on fertilitywithoutborders@gmail.com if you have any queries or if you want me to create a podcast on any topic of your choice. This podcast is available on Anchor, Headphones, Spotify, Breaker, Google Podcast, Overcast, Radio Public, as well as Apple Podcast. Do subscribe to any one of them or on Apple Podcast, and don't forget to leave your comments and suggestions. Looking forward to great interactions. Keep listening.